Well, hello again, everybody, and welcome to another episode of The Experience Maker. I am Dan Gingiss, customer experience speaker and coach, and I'm so glad that you have joined me today live for another discussion with somebody who's become the experience maker in their business. I'm really excited to introduce you to somebody today who I had the pleasure of working with at Humana for 2+ years. He and I bonded immediately and had a lot of fun there and a lot of challenges as well. And he is the he is the vice president of digital experience at Texas Health Resources. And we're going to talk patient experience with him today. San Banerjee, how are you, my friend?
I am doing well and happy to be in this show.
Well, thank you. I'm very happy to have you. It's been way too long since we gathered in Louisville, usually with the bourbon in our hand, to try to solve the world's problems, right?
Yes, absolutely. It's always a pleasure to see you and always a pleasure to be with you.
Well, thank you, sir. So let's dive right in. Obviously, we are in a moment of time where patient experience, unfortunately, has become a really big issue because we have a whole lot more patients than we had just a few months ago. So tell me a little bit about what's going on in your organization. First, maybe you can introduce your organization to us and tell me what's been going on, particularly in the last couple of months.
Sure. I'll start by saying about Texas Health. Texas Health is a $6 billion health system based out of Dallas. And we have both the provider business, which is the business that is the biggest business that we have, and also we are a payer in some sense. We are a partnership with Aetna that we have a plan on for some of the employers in this place. To your question about patient experience, yes, we are doing quite a bit. Times have changed with COVID-19 since March of 12th. I remember that date, to be honest. A lot of work has happened since then. We are trying to keep more and more things on the virtual side of the house because people feel safer doing things from a virtual perspective. So virtual has become one of the big ways to deliver care. We are also trying to do a lot of things in the hospital in the terms of way we do care, which is basically trying to ensure people have clear signs in terms of what they can expect. People have very clear expectations, both from a digital perspective and physical locations as well. And then at each step of the way, we are trying to engage them in a little redundant way as well, which is a lot of outreach. So whenever you schedule things with us, we'll do a lot of outreach to explain how this new process is going to work. So I think there has been a lot of shift in terms of our traditional way of doing things to new way of doing things in the way of having a little more steps and introducing virtual in every possible way to enable better experience.
Well, and you make a great point about expectations, because oftentimes with customer experience or patient experience, it really does boil down to meeting or exceeding expectations. And sometimes you have to alter those expectations so that you can meet them or exceed them. So I'm assuming what you're talking about is that today when somebody walks into a medical office, there are new procedures that they have to go through that they didn't before. And so by talking to them ahead of time, I would imagine that you would sort of ease their concern or worry about going into a medical facility.
Yes, that's right. Because I think a lot of processes have changed, right? Suppose if you get into a medical clinic, you are supposed to wait in the parking lot. Now, this can be really, really different experience for anybody who has not experienced that, right? So you have to ensure the right communications are there, tell them in advance so that they don't have the anxiety when they get to the place. So there's a lot of communication that has to be done, which may seem very, very simple, but it has a lot of nuance to it, right? And you have to personalize it to the right population that you are trying to serve. And also use more of written form of communication, right? Sending an email well in advance, like 2 days in advance, than just trying to tell somebody on the phone.
Sure. So that's kind of where I want to pivot next, is that your role is specifically digital experience. And as we know, one of the things that's happened with COVID is digital's become even more important than it was before. So tell me about your role and sort of to the extent that you can, what kinds of things are you working on healthcare wise around digital experience? What's the whether you want to look at it with COVID in mind or without, sort of what's the end goal in creating a digital experience in healthcare?
Yeah, great question. So I think when you look at digital experience, and as you kind of rightly pointed out, it came in the front and center after COVID hit us. And I'll tell you, the amount of digital work that I have done in the last 4 months has been surpassed the last 2 years of effort, right? So if you look at digital from a provider like us, it has four components. Number one is primarily on the patient engagement side of the house, which has taken a huge change in the way we engage with patients. The second is on the care management side, where the care happens and starts from your home going back to a clinic. So the patient engagement has a lot of digital touch points, and we are working on more and more touch points from a digital perspective to enable and elevate the experience there. The third component is all about follow-ups, right? Which is after anybody has an interaction with us, the follow-ups have to be done to ensure that we have the right outreach in place, as well as it also enables in a digital format. And the last one is all about creating new front door of delivery of care, which is through virtual channels. So, and this was not thought about before COVID-19, that virtual can do so many things than what we are doing today. So a lot of me and my team have been focused on these four buckets, and virtual care is in the front and center of us at this point of time.
Very, very interesting. And before I ask the follow-up question, I just want to remind everybody that's watching that you can ask questions to San as well. We'd be happy to bring them up. So please type them into whether you're on LinkedIn or Twitter or YouTube right now. Type them into the comments. We will see them here, and I will definitely bring your question up to San later in the program. So you mentioned virtual health, and sometimes called telehealth, and other things. And I actually wrote about this recently because it's happening all over. It's happening in the medical industry, dental industry, even in the veterinary industry. We've got patients, furry patients, going to the vet over Zoom. So tell us about what's going on in telehealth. And I think one of the questions that I really have is, do you think this is a temporary thing, or do you think this is a shift that may stick around?
Well, I'll start with your last question. I think the way it is shaping up right now, I think it is here to stay. All regulations are coming together to really kind of help enable telehealth in the right order. Obviously, there'll be a little bit of contraction in terms of going back to some of the normal stuff, but I don't think it is going away at all. In fact, the ways of using telehealth in different use cases is going to be more and more detailed. People are looking at in terms of how to use telehealth in the right order. So in short, I think what is happening in virtual health is all about delivering care without having any contact. Contactless as a word from a consumer experience perspective is a big deal, right? So, and it has given healthcare industry an opportunity to deliver contactless care through virtual. And I have never thought about that a specialist can see you virtually. It is always something that people think specialists have to touch you to really figure out what is happening. With COVID-19, specialists have gone on virtual as well. A lot of different specialties of healthcare is coming on virtual. And I think it also helps us understand the different behaviors of patients when they get into virtual care. It is about understanding who is trying to use what kind of information we can gather. So I think the hidden aspect of virtual care is the ability for somebody like us to capture a lot of information about consumer behavior and patient behavior when they are getting care, which is something that we are very focused on. This will help us hone better and also personalize the experience on the virtual care side. So the three things here, one is really standing up virtual care and expand and scale, ensuring that we can personalize it with the right data that we can capture. And the third is the ability to go beyond the traditional hospital medical clinic base to people's home. That's where we are focused on right now, saying how can we get virtual care at home which is where really people are at, and more and more use cases are coming up, and demand is coming up to enable those things.
And one of the things I remember that we worked together at Humana is that there are so many different organizations in the healthcare structure. And I know, for example, when this first started, one of the things that people were running into trouble with is that insurers weren't covering telehealth appointments for some reason. I don't know why. So how has all of that changed as every company in the world is trying to adapt to COVID-19? One of the unique parts of healthcare is that there's so many players that have to get aligned, whether it's the government and regulations to the insurer, to the provider, to the, all these people in the middle. How have you found working through that morass at a time when everybody's also in a panic?
Well, it has not been a straight and easy journey, to be honest. As and when we built these things up, we had to kind of look at all the pieces, starting from insurance, reimbursement, payments, patient payments, and stuff like that. I think one thing really helped was government regulations, right? And incentive schemes. CMS, for example, had been very clear when COVID started that CMS is going to reimburse telemedicine visits. Now that helped commercial payers to come along in terms of reimbursing telemedicine visits as well. So I think it was a combination of regulations. It is a combination of the need at that time. A lot of companies that are part of this food chain, if you will, had to really tweak their processes to make it simpler as well. So for example, a lot of these insurance companies, in terms of how do we verify insurance, there are new players that came up overnight, which it takes your insurance inputs and goes and verifies back with the insurance companies. So there has been a lot of good technical innovations that has happened. Regulations have helped quite a bit. And also I think consumers drove a lot of experience as well. Many people, the willingness of consumers to try virtual health has helped shape it up in a very short order. So I will always thank consumers because they took those visits, they gave feedback, a lot of survey feedback, and a lot of feedback to their provider saying, this is how I felt about this visit. Those help shape it up really well.
It's funny you say that because I've heard the same thing about digital wallets, which was something that was talked about in another job of mine when I was in the credit card industry, and how quickly people have adapted to touchless payments as well. Something that maybe was going to take a decade or more to really become prevalent among the masses is now something that people are all of a sudden willing to do immediately. So how do you think this changes healthcare, an industry that is, let's be candid, is known for sort of being slow to adapt at things? How do you think this changes the industry after we're done with COVID, now that it's learned that it can be disrupted at any time? There's, as you mentioned, there's new companies coming up overnight, and B, that you got 2 years worth of digital stuff done in 4 months, which would have frankly never happened had this not occurred. So how does that, do you think culturally the whole industry moves forward?
Yeah, I think that's a great question. I think the way I see this is COVID-19 has really created a new normal for healthcare. That's where I'll start. And the new normal definition is everybody has to go back to their drawing boards and figure out how to create demand. What does demand look like from a consumer perspective? What does servicing looks like, right? Because servicing is not what your traditional way all of us used to service things. And how does new tools and techniques have to be brought in to deliver the care that is needed? What does care coordination look like? So I think with COVID-19, this healthy tension, I use the word healthy tension, has been created within all healthcare organizations to really kind of react and adapt to the new things. And I see this as being a curve, which probably will play out in next 1.5 to 2 years, that many companies are going to change their existing course and adopt new things for them to even survive. And I use the word survive with very caution because that's what it is all about. Consumers and patients are choosing in terms of what care they really want to get to, right? So you have regulations, you have a lot of other things, but at the end of the day, this is, I call it utilizing healthcare has already started, and COVID has accelerated all of that. So everybody has to start thinking about what surviving in this new normal looks like, and there is not a straight answer. There are a lot of entities, a lot of ecosystems that has to be coming together to revolve all of that. But I will tell you this, that on our side, that work has already started. And 2021 will be a very different year for us. Even our planning is very different. We are planning for our worst. We're assuming there's another pandemic coming. How do we plan for it? And that's not the usual way in healthcare used to really work. And I think this is a big learning lesson and adjustment to our new normal.
Yeah, great point, Dan. I also wrote a piece recently about business continuity planning, and you know me, I tell it like it is. And I remember how many BCP meetings I sat in at a variety of companies, and everyone around the room just sort of rolled their eyes and said, "Well, this will never happen, and this will never happen, and why are we even talking about this?" And then I think most companies realized, maybe you mentioned March 12th as the date. I think by about March 20th. They realized their BCP plan was complete garbage and they needed to throw it away and start over. And I do think that is going to be taken a whole lot more seriously going forward, whether it's a pandemic or it is an environmental disaster or, God forbid, a terrorist attack or whatever, anything that could disrupt business. I don't think we're going to be hearing as much, "Oh, well, that could never happen anymore," now that we've been through this, because I don't think this is something anybody thought could happen. And what I think the other interesting thing that you've mentioned is that one of the things that is coming out of this is an unbelievable amount of innovation that will stick around and likely for the benefit of society. And so you don't want a pandemic to have to create that, but I do think that's one of the positive outcomes here. As you were talking, go ahead.
Yeah, one more point I want to mention here is that also I think this has started a new way of questioning our existing set of things, right? So whenever things like COVID-19 happened, I think we all have started questioning our existing set of things that we already have in place, right? So you question your existing processes, you question your existing stuff. There is not an saying that, well, can we just keep doing the way that we are doing stuff? It has become more intense now, right? Because you are now getting measured in a different baseline than what it used to be. So that is another big thing that is happening at this point across the industry. People are not just accepting the baselines and the processes that has been there.
Which is great, because that inertia is often the biggest preventer of innovation. And that's so right. If you can get past that inertia out of necessity and you can break down those brick walls, you've got now some opportunity to try some things that haven't been tried before. And I think also what we found is that the public has been very receptive as well and adaptive. And so things that maybe we've asked customers or patients to do before that would have been hard to get them to do. Can you imagine a year ago asking patients to arrive at the office with a mask? I mean, like, that would have been hard, right? Yeah. And so there's been a lot of adaptivity, I think, among consumers, which I do think also opens up the door to some more innovation as well, because you might be willing to try things and you might get a more open audience than you would have just a couple of months ago. It's funny you mentioned March 12th, because I got off the stage, I think it was March 10th, was the last time that I spoke on a keynote. And man, that was cutting it a little bit close. But even then, I remember I was at an event and there was still a conference going on, and I must have grabbed the hand sanitizer 50 times that day. So I definitely remember that. So for some reason, while you were explaining this last piece, I started thinking I wanted to ask you, what were you working on before COVID? Like, what did you have to put down because all of a sudden the world changed?
Great question. So before COVID-19 hit us, I was working on a consumer front door. in terms of reimagining consumer front door, in terms of how consumers can come in and we can look at all the access points, make it easier for the consumers to come in. I had to drop it because at the end of the day, we look at the stuff that has to be done now to address what COVID-19 is. And I had to reprioritize a lot of consumer front door activities in service of making things better in terms of virtual, trying to coordinate, do better care coordinations, set up patient outreach programs in a digital format, enable SMS texting for people coming out of ER, emergency rooms, so that they can reach our emergency physicians. So those are the kind of things that took over the consumer front door, which was completely a consumer experience driven set of initiatives and had gone into a more of a pandemic response to really get things going on the digital side.
Yeah, it's really interesting. And again, I think it'll be really interesting to see across all sorts of companies the queue of projects that was there pre-COVID. Where does it go, and do we ever come back to it? You know, because those were all really, really important things for a while, and then all of a sudden everything changes. So I want to put up on the screen here just for those that want to go find San Banerjee on the internet. He's on LinkedIn at Banerjee San, and also on Twitter at Banerjee San, but with a little underscore there. So definitely connect with San. San, you are one of the smartest guys I've ever worked with. And you and I loved, I mean, honestly, one of the best parts of working at Humana was the late nights you and I would have at the bar, just trying to solve the world's problems. And it was super fun. There's always, I mean, I've worked with a lot of people over a lot of companies in my career, and there's always a couple of people that you just sort of know right on that you're going to get along with, and somebody that you're going to be a lifelong friend of, and I knew that about you pretty early. So I love that you're here talking with me, and I'm glad that you stayed in the healthcare industry, because I know to be perfectly honest, you probably had more passion for it than I did.
You should know that I reciprocate the same feelings for you as well, and you have been somebody that loved and enjoyed working with you all this while. So, and I know that at some point we will get back to those late evenings together.
Yes, exactly. I miss them, and yes, we do need to get back to that. That's awesome. So we have only a couple minutes left. Anything that you want to cover or talk about that I haven't brought up, or anything else that's going on that you want to chat about?
Yeah, sure. I think there are three things that I want to talk about here. I think number one, we keep talking about patient experience, but patient experience is not a word that is well understood, and we are not thinking about patient experience within hospitals. We think about patient experience in outside hospital, which is clinics and people's home, but there is a huge amount of patient experience to be taught within the hospitals, and it is something that people really have to focus on. There's an experience in the hospitals itself. So that's one. Second is, if you have any digital initiative that you are leading or co-leading or have started, you have to keep in mind that the timeline of those projects has to go down from 1 year, 2 years to 4 to 6 weeks. That's where we are. And that new normal is not going to change. So if you have a business case that you are doing a project or initiative with 1 year of ROI, you should really put it aside and create a new one where you are able to create value within 4 to 6 weeks. That's my biggest learning out of this COVID-19. And the third thing is that co-create things with consumers, do more surveys, get out there. People are at homes. They are more willing to talk to you. They are more willing to participate in any surveys that I have. I had never had any situation where there is a survey and it's not happened or it's not oversubscribed. I always have got help from consumers. People are more keen to listen to you, more keen to work with you, more keen to co-create with you. So take advantage of that to create the best experience that you really can do for the patients and to the community. Those are the three things I want to leave the group with, and those are my 3 words, Dan, and I strongly believe in them.
I love it. I love the concept of co-creation. It's so important to be listening to your customers they often come up with ideas that you would have never thought of because, we as workers are sitting behind our desk and we're trying to solve a problem. And when you talk to the customer, sometimes you figure out, first of all, you're looking in the wrong place because the problem's actually over here. And then you also get great ideas from them and creativity and things that, we may not have come up with ourselves. So I love that concept of listening to customers in 4 to 6 weeks. I think that's, man, it sounds aggressive, but it makes a lot of sense because 4 to 6 weeks in the last couple of months is a lot different than 4 to 6 weeks a couple of years ago, right?
Yes.
So it's like every day, every hour is exacerbated a little bit more. So I think that's fantastic. San, it has been an absolute pleasure. Great to talk to you as well. Looking forward to catching up offline as well. And thanks for taking the time today. Really appreciate it.
Absolutely. Good talking to you as well, Dan. As always, pleasure. And we will definitely connect. Thank you again.
All right, outstanding. That was San Banerjee. He is the Vice President of Digital Experience at Texas Health and a good friend of mine. I'm Dan Gingiss, customer experience speaker and coach. I want to invite you to sign up for my bi-weekly newsletter. That is bi-weekly, which is twice a month, because I don't like getting a whole lot of email either. So I figure twice a month is not really intrusive. Just go to bit.ly.com/Gingiss email or the bit.ly/Gingiss email to sign up for my bi-weekly newsletter where we talk customer experience, patient experience, and other tips and tricks. Next week, we're going to have on the show another really cool guest, Lex Monson, who is the co-founder and CEO of one of my favorite companies, one that you've heard me talk about on stage, one that will be featured in my book, Punk Post. Punk Post is an organization that allows you to send handcrafted cards to friends, family, and colleagues, and they are hand designed by artists. And I'm telling you, when you receive one of these, it is something else. And it is such a great business and a great opportunity for people in every industry to thank the people, customers, and clients that they work with. Thanks again for joining me. Really appreciate it. We'll see you next week and every week, Thursdays at 4 p.m. Eastern Time on the Experience Maker. This is Dan Gingiss. Have a terrific weekend.